What size bra do you wear?
An A.
Okay. And what size would you like to be?
Probably a small D or medium D.
Okay. And have you had children?
No.
Okay. Then the next thing is, let me tell you how we do sizing. I think you want to look good two ways. One is in your clothing and one is with your clothing off. So what we'll have you do a week or two before surgery, my nurse will put a bra on you and a t-shirt and pads in there until you fill your blouse out an amount that to you looks good. I'll then get a scientific notation telling me exactly how much bulk you want there. And then I'll want you to bring in a picture or pick one of our pictures of a naked chest so I have an idea of what you think is proportional. At the time of surgery, we'll do the surgery and I'll put a temporary sizer in there and inflate it to the size that we think we want. Compare the way you look to the picture, adjust up or down a little bit, and then I take the temporary sizer out and put the permanent implant in. Basically, an implant is a shell filled with something. A saltwater implant, that shell is filled with a solution of salt water. A silicone gel implant is a more complicated shell, but it's filled with a mixture of gelatinous silicone. We have the new cohesive gel implant. This is under clinical trial. The advantage is it has shape, and as you can feel, it is firmer, so it's more youthful, and it has shape. Like most women, your breasts are not absolutely identical, but you're close enough that we'll put the same type and size implant in. Now, for the silicone gel implant and the saltwater implant, we go through just right the edge of the areola. That hides the scar really well. The cohesive gel implant is stiff enough, I have to do a little 2-inch incision right at the fold of the breast. So those are the 2 incisions that we use. The other choice is to do it endoscopically. Then what we do is make a short incision in one of the natural folds in the armpit, and we can put a saline implant in through that incision, and then there's no scars at all on your breast. After surgery, you'll have this big bulky dressing on. The next day, we'll take all of that off. You'll have a much lighter dressing and a surgical bra on. We use a device called a pain pump. It's a reservoir with long-acting local anesthetic and 2 tiny little catheters about the size of a paperclip wire. One goes in here, one here, and it numbs your breast so that you're much, much more comfortable after surgery. 3 days after surgery, you just pull those out yourself. Your skin is numb, so you hardly feel it coming out.
I have been uncomfortable with my breasts since I was probably 15, and I thought that they would get bigger maybe whenever I got older, but it never happened. So I think this would be a perfect opportunity for me to get that done. I am ready to be comfortable with my body all the way.
A week before surgery, Amanda comes in for her pre-op visit. In the pre-op visit, she will try on a series of sizers to figure out which implant would look best on her based upon her height and weight and look that she so desires. Amanda starts off with the 360cc sizer and ends up picking the 500cc implants for her surgery.
Yeah, I really like these.
Today is Amanda's big day. She's on her way to the operating room for her breast augmentation. Dr. White first begins by making an incision in the lower part of Amanda's nipple, where he will insert the implant. Next, Dr. White gets out the saline implant, the size that he and Amanda had agreed to at their pre-op visit. He will insert the implant through the nipple and underneath the breast and the chest muscle. Now that the implant is in place under the muscle, Dr. White will begin filling up the implant with the saline solution through a small tube that is connected to the implant. Dr. White now has the implant filled to the size that he feels that Amanda would be very pleased with. He'll be closing up the incision and beginning on the other side.
I'm really excited that I can go shopping now and finally look good in my clothes, and now I'm more confident. I thought it was going to be more painful than it actually was, and it turned out that I just needed to take it easy for the first couple of days, but I wasn't even in hardly any pain whenever I woke up. I was just a little bit sore, and still I'm a little bit sore, but it was definitely worth it, and it's just not anything more than like a little bit of discomfort. I've been saving my money, and I'm gonna get a big tax return this year, so I'm gonna get a whole new wardrobe. I would just recommend getting it done if you're not very confident. Like, I got a better result than I even expected.